Okay. So now this is the same child, which was 10 years old child. Uh, he is now, well, he has a case of multiple sclerosis on immunosuppression therapy, developed pneumonia, and post pneumonia he had went to the ARDS. PF ratio was around required to be put on ventilator. On ventilator, PF ratio remains 68. So he was counseled for ECMO and ECMO initiated. Okay. Today is day 5 of ECMO. He was doing well. Yesterday only, while giving a nursing care, there was a cannula got kinked in the drainage circuit, limb was got kinked in the railings, and because of that the flow is decreased and saturation is gone down to 60, and there was a hypertensive response and tachycardia was there, but it was diagnosed immediately, so things were settled down immediately. Okay. Now, these are the parameters what you can see on monitor. It's over to you. Now it's your patient. So you have to decide, monitor the patient and decide what you need to do. Okay.
Divide.
We'll divide.
So we'll divide into two groups.
Yeah.
One group will be looking after the patient, whether the lines and tubes are in place or not, and if there are any active concerns with the patient, and the other group will look into the monitor and the ECMO machine and any problems to be identified in the machine.
Okay. So do it. It's your patient now. How you want to do it?
So this side we'll have a look at the machine. So this patient is 20 kgs.
Yeah, 20
20
kg.
kgs.
Yeah, 20,
And
25 kg. Yeah.
And the flow is 1.5
Yeah.
liters per minute. So it appears a bit less.
It's on you. You decide if you want to go up on the floor. You can go up on the floor.
P1 is negative, minus 47. So we have to rule out all the causes of this thing. So it could be a clot, it could be a displacement, it could be a kink. So we'll expose the patient and see if there is any kink or there anything in.
You, two of you take care of the ventilator.
So you please look at the
Saturation is
ventilator and
maintaining.
Huh.
no kinking in the cannula.
So how is the last ABG and what sort of inotrope supports the child?
It's not on any eye drop. A last ABG was pH of 7.38. PO2 is around 58. PCO2 is around 36. And bicarb 22.
Now the saturation has started falling. Increase ventilation.
P2 is
Optimize the ventilator
gas.
No, one of them. The ventilator person, please increase the FiO2 to 100%.
FiO2 on this machine, sir, how is it? On the ECMO, the FiO2 is 100. Okay, then we'll have to go up on the ventilator FiO2.
SpO2 is 56. We can increase the flows also. P2, P3 is increased.
It has become darker. It is having hypoxia.
The color is the same in both the tubings.
Yeah, you
So
can
it's
see.
hypoxia.
So it has become darker.
Sir, ABG of the post membrane and the pre membrane.
You want to do an ABG of pre and post
Pre
membrane?
and post membrane.
Okay. pH is pre membrane. pH is around 7.28. PO2 is around 45. PCO2 is around 56. And bicarb is around 20. And post oxidator pH is around 7.28. PO2 is around 45. PCO2 is 56. Bicarb 20.
So there is
So the
oxygenator
problem is with the oxygenator.
Failure of the oxygenator or the blender.
So we'll first change it to the oxygen cylinder.
This
Can I
is your
get
patient.
oxygen?
Patient saturation is 56. You decide what you want to do.
blender. We'll see the blender.
We'll
Look at the
connect
blender.
to 100% oxygen.
Connected to 100% oxygen.
We have connected, changed to 100% FiO2 on the ventilator.
Ventilator FiO2 settings.
Blender
Can we
15
do
liters,
hand
no?
bagging also? We have connected to 100% oxygen and
100% oxygen where?
To the
except
flow meter,
excluding
flow
the
meter.
blender onto the direct flow meter.
You want to connect. So You want to oxygen cylinder?
Yes.
To the oxygen
Give
cylinder.
them oxygen cylinder.
Any problem
So
with the
where
blender?
So do it.
Then
We do a torch test to look at the oxygenator if any clots are there.
so can we do a torch test and find out?
And in the
Yeah, we'll give
meantime,
you
one of the team, two of us will get
Should
with
we
the
be doing,
oxygenator
hand
to
bagging
change
for the
the.
patient because saturation,
Even
sir,
after
it has
FiO2 is
gone
40,
off.
we can increase it to 100.
We don't know the SpO2. Yeah, we can increase the FiO2 to 100%, and we can do hand bagging also. We don't have a recordable saturation.
So you increase to 15 liters.
Monitor the vitals.
Yeah, 15 liters. Yeah. So oxygen is increased, sir, to 15 liters. FiO2 is being increased.
But still,
Oxygen increase 15 where?
In that,
sir, in the
So you
cylinder.
want to keep sweep gas of 15 liters.
To
no. We'll make it less. We'll make it 8,
So
and then we'll
you
see.
decide
that
and
is
tell me.
100%
15
FiO2.
liters for 15 seconds to decrease the role of membrane
Membrane
edema,
edema.
Okay.
and then we are coming down to 2 liters again.
Okay, fine. So do whatever. Yeah,
So
that's
the
fine.
monitor is off.
Monitor is off.
Yes, sir.
एक मिनट सूरज को बोल दो.
Here also, sir, FiO2 we have not increased to 100%.
Yeah.
So we have done
FiO2
a
in the
torch
ventilator.
test.
Okay, I'll do that.
Okay.
So we have done a torch test. Can we see clots in the circuit?
There appears to be
Meanwhile, I'll get an ultrasound done, sir, for the chest focus.
Torch is here. Can you see?
How old is the oxygenator? It is
5 days.
day 5, sir.
Day 5.
Oh.
So we'll change the oxygenator. Is
Differential-
everyone
differential-
okay with it?
Differential for hypoxia.
Meanwhile, can we?
to find out any causes there which could be contributing to the hypoxia.
Hypoxia and the flow is also less.
We can go up on the floors. We can go up on.
रुक अभी मत चालू करो वो. मेरे को उसमें changes कर देने दे.
So what else can be the?
इसको
I
यहाँ पे
want
रख
to
वहाँ
check
पे
and
हल्के
look at
मत
the
जा.
ultrasound,
मैं change कर दूँ
Yeah,
उसके
for
बाद.
pneumonia.
in the
But
meantime,
the
the
focus is
oxygenator change. Are we going for
We have
it?
to
or-
rule out the machine causes and
Machine, we have the oxygenator because pre and post membrane it is the same.
हाँ.
Yeah, so there is something wrong with the oxygenator. And we have checked for clots.
Clots and
If there are clots, then we have
clots
to
you
change
need
the
to change
oxygenator.
that. Get ready to change it. Where do we have to plug this?
We
This
need new
clamp,
oxygenator also, right?
clamp.
Let the monitor come at least.
No, in the meantime we can plan it.
Yeah, we have an extra oxygenator in the room. Should someone start for a priming of the oxygenator in case we get clots?
we have to take out the oxygenator. P2, P3 difference is less.
You want an oxygenator?
Uh-huh.
Okay, give them an oxygenator.
Change the oxygenator.
But the delta pressure, has it changed? We are not sure. Delta pressure was same. Check this clock, the delta pressure should rise.
The
Loads
pressure
have gone up.
is the same.
No, it has to be.
No. There is no clot then if the delta pressure is the same.
So there is P2 is equal to P3, both are low. That means it has to be blender. Blender is not
Blender we have already changed.
we change, but what happened we don't know.
We have to wait for the monitor to come. Sir, is there any improvement in the saturation?
No,
that's what
I'm
saying.
just
That is
getting
the
the monitor
normal
on.
value. But delta pressures are not high, so oxygen cannot be the problem.
Because P2
We have just told the scenario here. Let me hemodynamic monitor comes and we'll start.
delta pressures are just.
P2 increased, it's 30. P2 minus P3 is 30. 49.
Delta
One
pressure
is
is
more negative and hypoxia.
So
tachycardia.
there is no improvement after changing the blender.
Patient sedated.
Delta pressure.
You have given them the oxygen cylinder.
Yeah,
Yes.
given
You
we
have
have
situated
connected
connected.
to
Okay.
oxygen. Yeah.
Can we increase the
Saturation is still low.
You whatever you, just your patient, you do whatever you want to do.
Hello.
I have no problems.
I would like to rule out
Hello.
other causes of hypoxia,
Or
such
from
as ultrasonography, to rule out any pneumothorax or
Take mic and speak.
would like to do
Hello.
ultrasound to see if there is any pneumothorax or some other reason to cause hypoxia.
Okay.
I'll be auscultating.
Ultrasound machine will take some time to come.
Yeah, I'll auscultate the lungs first. I'll get a CT,
Auscultate
X-ray,
lung.
X-ray chest, sir.
Take
Hello.
15 minutes to
X-ray
come.
and an ultrasound.
Bilateral
Hello.
air entry decrease
Check.
on
Hello.
X-ray, on auscultation.
Bilateral air entry decreased. Okay.
We'll do a POCUS.
Done already. No, the machine is coming.
Secretions.
Machine is coming.
Yeah, machine is coming. इसको जल्दी करने को.
Hello.
56.
So
Delta
bilateral
P
air
of 30
entry
is
decrease.
Hello.
okay.
Hello.
That is okay. So
Check the tube. Bilateral air entry
Secretions,
is,
secretions,
yeah.
Air
For any
bilateral.
secretions,
pressures are all
tube
normal.
block and suctioning.
Peak pressures are all normal.
but still, we'll check whether the tube is in position.
Which
Peak
tube
is
you want?
24. It
Peak
has
is
been like that since.
There is no change in the respiratory.
Do a manual ventilation. We'll check
Sir,
for
the
the.
color
Anyways,
is still,
when it is
the
on
color of tubing is still
Blood.
the same, sir. So I think we need to check the blender.
Recirculation.
So you are
Blended
now
we
switch to oxygen, na?
yeah.
Oxygen cylinder, isn't it?
That has been changed, but no
But
difference.
still the
If it is the same, we
Can we increase the
Bilateral air
flow,
entry
sir?
has been
It's-
decreased.
You do whatever you want.
So
It's your
flows
patient.
have been increased. Oxygen has been there. There
How
we
much
have
flow you
done
want to
it.
increase? Also, flow उनका बढ़ा देना.
2.1.
3 liters? No, sorry. 3000 RPM.
हो गया क्या उसका?
हाँ?
खूबसूरत मैं करूँ
ठीक
क्या?
है।
So why should
ABG.
bilateral air entry decrease?
We'll get an ABG done at this point, sir.
We have checked the
ET
tube
CO2 is
position,
coming.
sir.
Which
It
tube you
isn't.
said?
ET
ET
tube.
tube
Position.
position.
It's normal and secretions also. I mean, we've done the
Can we
section
check the
also.
cannula position once if they're in right place?
Which can you
Yeah,
position?
with the
The drainage cannula and the return cannula?
cannula positions. With
Okay.
the ultrasound.
It is almost the same.
So our flow is now better. Flow has gone up to 2 liters, but the saturation is still low. We have already checked for
Check the
membrane
pulse
edema.
probe once.
Then only oxygenate.
No, the color is the same. No need of checking
The
pulse. It's evident that he is having hypoxia.
Change the oxygenate.
No
The-
air entry bilateral. So need to get
The
an
pump is
ultrasound or chest
working
X-ray
fine.
first.
There is no sound coming from the pump.
So still the P2 is very high. What about the oxygenator? We should be think about it.
The difference is normal and delta is 30 only.
What is the trend in the P2 and P3, sir?
It is remain almost the same. What is happening?
lung,
Stab.
maybe the lung condition has worsened. We need to check the X-ray, sir.
But
Not
for
required.
that
I
we
think
have
what you
already-
need to do is go back. I will give you 1 minute, 2 minutes. Think over what are you dealing with exactly. Are you dealing something wrong with the patient or something wrong with the machine, something wrong with the ventilator? And then think, because we are going both the directions, isn't it? So first you should broadly classify where you are. Then you will be able to focus it more clearly.
The prime concern is both the cannulas have the same color, dark color
Okay, so
Yes,
that is
so
your
the machine-
concern.
yes,
So that
that
is
is the
something wrong with the machine.
Yes, sir, machine.
So can you focus more on machine?
Machine, yes.
In machine, which component you are looking at?
Oxygenator and
Oxygenator.
oxygenator, sir.
You are looking at oxygenator and blender.
Blender.
Okay. So for blender, what you have done?
Increase
We have changed
Change
the
the
pressure to
blender.
100%
To
You have
oxygen.
changed into oxygen cylinder.
Oxygen.
Did it help?
No, sir.
No.
It is worsening.
Yes.
Patient going into bradycardia.
So something
Oxygen.
wrong with the
Oxygenated
oxygenator.
change.
Oxygenator.
Now you feel something wrong with the oxygenator.
Oxygenator, so we'll plan for changing the
Changing of
oxygenator.
the oxygen.
You want to change oxygenator.
We just
On what basis?
But the pressures,
pre and post
their
Pre and
membrane.
post
pressures are
oxygenation.
not that high.
Pre-oxygenator, post-oxygenator.
Delta pressure is
Normal.
Normal.
static.
Static.
Okay. You didn't find any clot in the oxygenator. Okay. You didn't find. Yeah. Then
Membrane edema,
Edema was ruled out.
Edema,
15
we have
liters we
done
have
the
flashed it.
membrane edema is also not there.
not the,
In membrane edema again desaturation will not occur, isn't it? So what else?
Is the cannula position is the same as it was before. There is no recirculation component happening.
But do you think, are you suspecting recirculation here? No. It is a dark color.
Dark colored.
So recirculation is also out. Then what? So problem
It's
with
not
blender
connected.
and oxygenator.
yes.
Is there anything between blender and oxygenator?
The pump.
You rule out blender, you rule out oxygenator.
If nothing is
Is there anything between blender and oxygen? Just think logically.
Connection.
pump. Pump में तो we
Pump
it's
between
gas.
blender and oxygenator.
No.
Yes.
first it comes.
Sweep gas also we have changed.
This
Between
connection.
connection is there since many days. It is not reconnected. It has been running for last 5 days, right?
Yeah,
So connection should be fine.
I don't know. If you have doubt, you can change the
So
connectivity.
it got disconnected probably. You have to check the connection from there till
But
here.
then that would have come of saturation.
Connected, na?
Yes, sir.
And this is on.
What is there between?
There is no oxygen in the oxygen cylinder.
The pressure gauge must be showing na whether there is oxygen or there or not there. There's a good differential diagnosis. I agree.
Hello.
Next time keep that scenario.
Yes.
Pressures are same, so
That bobbin is not there.
You are close to it and you are going away from it. I don't know why.
Bearing?
so blender, oxygenator, and then it goes back to the patient. There is no clamp in the circuit.
One more oxygenator will keep.
Do we
Or
need
else you'll
another
arrest.
oxygenator in parallel? Because
No, flows are less.
Do whatever you want, but you have to justify me what you are doing. Parallel oxygen is going to cost 1,10,000. Almost 5 to 6 times your course fees.
There must be leak somewhere, sir, from the oxygenator.
So what do you want to do?
We want to check it, check the leak.
Where?
If the system closed,
Leak in the tube or oxygenator?
it can be both.
So what? You want to change connector?
Yes, the
Leave them to connector. Change the connector. Yeah. We'll give you the connector.
What's in between blender and
if the color is the same, it is recirculation.
Recirculation.
I have to do whatever. Na? You
We have changed the tubing.
so nothing is working.
Sir, we have changed the tubing, isn't it?
Now the problem will be with the oxygenator only.
Wrong
There must be
readings.
change the oxygenator.
wait, connections are correct only.
still anything else is remaining.
Outlet,
This is the drainage.
wrong
coming
connections
here.
can also lead to this.
You want to change the oxygen directly?
No, sir, no.
No.
Hypothermia,
What is the temperature that we have?
Temperature is 36.
What are
Will
the-
hypothermia present like this?
No. Okay.
You are touching and going. You are very close to it and then you are running away.
Whether the stopcocks are aligned properly and all,
So
just
bridge
check
is fine or
everything. Yeah?
bridge is open?
Huh.
It is
The bridge is, this is not a bridge. This is connected.
this is connected over there.
Yeah, this is not a bridge.
But these are all connected to the circuit.
Yeah.
This three-way is open, I think.
What is
This
this?
three-way
Is there
is
a
open,
clamp
right?
or
This
anything?
mitral is open.
No, there is a flow sensor.
Flow sensor.
This three-way is open.
Okay,
It's
should I
open
stop
here.
now
It's open
or should we
here.
go ahead?
Yes, sir.
Anything else is remaining changing?
So the
You have
pump,
changed blender.
we have changed blender oxygenator.
You have changed the pipe. Have you changed the complete pipe?
No. This
No,
part
this
is,
part is
I
left.
didn't
You want to change that part and see?
Yes.
The HME filter.
You want to change that part? And
Yeah,
Sir,
yeah.
we have changed the pipe.
Initially we have changed the
HME
whole pipe.
filter.
No,
We
she
have
has not changed the whole pipe.
Yeah, I didn't
this,
change it.
this part is not changed.
Connect it. This can be the leak. Ha.
So what is the problem?
This is the problem.
There
The
was a
there
leak
must
in
be
On
the
patient,
sweep gas
on
port.
ventilator, okay. If suddenly your tidal comes down, what do you do?
Disconnection.
Leak. Other possibility?
Displacement,
Displacement
obstruction,
of
pneumothorax.
You check the
Can-
your
Check the
filter, isn't
entire
it?
connect.
HME filter. HME filter gets blocked,
Clogged.
isn't it, at times? Yes or
Yeah.
no?
So when
Because
we
if you
asked
make-
for the circuit,
we asked
it
to
was
change the
not
entire
given, sir.
circuit.
No, we have given you completely.
No,
Whole
no, no,
complete was
only
not
this
given,
is
sir.
given.
That was
So
Arre,
the
it was
back
there.
part is given this.
See what that circuit has got HME filter there.
We already have
So you
got
kept
one
two
HME
HME
filter here.
filter. You didn't remove that HME, the circuit with the HME filter, isn't it?
Okay.
Okay. So what was your diagnosis? You have to be clear about what you are thinking. Okay. You did well. Diagnosis was quite fast. And management was initially you were going in track, but then I don't know why you were started getting distracted. See, what was your main problem? Desaturation. What did you find? Both the tube color becomes same.
color.
That also you diagnose fast. Both the tube colors are
Same.
dark red. That means there is something wrong with the sweep gas failure, isn't it? There is no other two differential diagnosis. Other differential diagnosis for both the tube color becomes same color,
None, sir.
bright red.
Bright red.
Both are dark red.
Misconnection in VA ECMO,
No, both are dark red.
dark red.
Dark red.
Sweep gas failure,
Sweep gas
that is
failure,
one.
oxygenator
Second,
failure.
Blender.
oxidative failure usually not present like this. Anyway, that massive oxidative failure that can still be
Recirculation.
no recirculation bright red.
Bright red.
Blender failure.
Third,
For dark.
methylene
Blender
blue.
failure.
Methylene
Methylene
blue.
blue intoxication.
Intoxication, or have you used methylene blue or severe rhabdomyolysis? These are the differences. But in methylene blue and rhabdomyolysis, your saturation won't drop. Your patient will not have bradycardia. Your patient will not have hypotension or hypertension response. Hemodynamically stable. These things will not change. So that means it was clearly, it was a telltale sign that there is something wrong with the sweep gas failure. So now when you are thinking about sweep gas failure, start thinking from where it can go wrong. Right from one source to other source. So it can go from wrong from the blender. Blender starts with what? Blender is connected to the oxygen pipeline, air pipeline. So there is something wrong can go here. Okay. So suppose your air pressure and O2 pressure are not same. Okay, your blender will not function. That is one thing. Second thing, suppose by chance you have connected the blender in a wrong way. Means air port is connected in the oxygen and oxygen port is connected in the air. What will happen? It's reverse condition. So what will happen when you keep FI to 100? There's not FI is 21.
It will be 21 only.
And when you keep FI to 21,
It will be 100.
it will 100. So again it will behave as a sweep gas failure. Am I right? So these are two possibilities at the source. Okay. Then something goes wrong with the blender. The blender is malfunction. The blender valve is ruptured or something wrong with the blender. So this is the third possibility. What you have done for that? You have changed it to oxygenator. So when you change it to oxygenator, you have finished everything before the blender. Okay. Now still there is a problem. So means what? Blender was not at fault. Fault is after the blender and before the oxygenator. What is in between these two?
The tubing connecting it.
Connects.
And the
So there can
HME
be filter block, there can be tubing leak. So if there is some crack in the tube, it keeps on leaking, that can happen. It can be disconnection, as simple as that. Somebody by mistake pull the tube out, okay, or it has come out by itself, not connected properly. So these are the differential diagnosis of swift gas failure, isn't it? So when you have telltale sign, you have to just trace and follow it. I don't know why you are getting distracted to the patient when there's nothing wrong with the circuit pressures. Okay, there's no point in thinking about pneumothorax or causing anything. Okay.
Bilateral, no air entry.
So decreased
So
air
in
entry.
ARDS, what you are going to get? The ARDS requiring ECMO. Do you expect good bilateral air entry? The lung compliance is poor.
So we have to know the trend, how it was yesterday, and is it the same today?
Yeah.
Maybe it was the same yesterday.
Circuit pressures?
No, sir. The air entry. The air entry.
Yeah. It's
Probably
going
in
to
the morning.
and
how
see,
it
anyway,
was.
when you go and see your ARDS patient, how many of you feel as air entry is good? In any severe ARDS requiring high ventilator, do you get good air entry? It's always a poor air entry. Bilaterally, it is low air entry. The
So
lungs
just
are
to
very,
confuse.
compliance is low, isn't it?
But HME filter, will it present as a sudden change, sir? Suddenly? It
Yeah,
will-
it will.
Because it will be a gradual process. No.
No. See, what happens here
If it
is
gets clogged.
Condensation
clogged.
in the HME filter.
condensation occurs, it gets clogged. See, even it comes down suddenly, you will not come to realize it, isn't it? So suddenly it not going to take days. It may be few minutes, it will and get stopped completely. Okay.
So can I connect the pipe, oxygen pipe directly without HIM?
Yeah, we can. To
We
just
can connect it
temporarily-
without the HME filter.
Yeah, you can connect it without HME filter also. Only HME filter is to prevent the water molecule to go inside, that's it.
So how frequently should we change the HME filter?
Is it no hard and fast rule. But whenever you have some suspicion like this, there's a fence. I don't think any perfumes in your group. Yeah, if they would have been, they are the one who thinks first about HME filter getting blocked. Okay, fine. Any questions?
So why did the flow go down?
Flow did go down?
Yes, sir. It went from 2.2 to 1.9.
No, I didn't. There might be some-
1.5 also at one point of time.
Then that was to start with. When you came, it was 1.5 only. So your previous batch has decreased the flow, so it must have remained same. It's not that we have decreased the flow. Any questions? Have you got what was your problem?
Yes.
Otherwise, you started with well. You came as a team. You decided that you are going to crack the mystery, and you were quite fast enough to recognize the mystery. But and you are very close. I told you three times. You are very close to it.
So
Close to
we
it.
were thinking that
When we changed the connection, we thought
we thought the
changed
entire
everything.
connection is changed. That is where we got confused. We thought this entire part is already changed.
No, filters he didn't change. I was about to modify everything. I got up and saw that whether she has changed the filter or no. And says she has not changed the filter. She has changed everything else.
Sir, and the cylinder has
So
no gas.
we had just
So
told
I got confused with that also, whether the cylinder again needs changing because it has no gas.
Anyway, fine. So, okay, well done. Otherwise, any question from the audience?
Anyone? No question, sir.
No question. Okay, fine.
Group C is here. One question, sir.
Yeah.
If group C is here, you better
send the
start
group
moving
here.
up.
Yeah, yeah.
Sir, my question is, when we already have this temperature regulator, what is the role of HME?
HME for
What is the role of HME when we already...
see, HME is connected to the sweep gas. In sweep gas, you see that there is always condensation that occurs. Isn't it? That is why there is a membrane edema that occurs. So that the fluid should not go inside. So that's the reason that has been kept. See, that is your This is not connected to your this is your blood line. This is going to get connected to the sweep gas line. So the cold oxygen which is coming, there's a filter there which prevents the even the bubbles to go inside, the water molecules to go inside. So it is not HME filter, it's just a filter to prevent the water moisture to go inside. Okay. So before you go,
Sir,
what you learn? Yeah.
For membrane edema,
Yeah.
what will be the feature in that case?
Membrane edema will be presenting
Desaturate.
only with the CO2 which is going up.
Mhm.
That's it. Rest of the things will remain the same.
Oxygenation will be maintained.
Yeah, oxygenation will be maintained.
Okay, sir.
So one point you learn. You start from here or start from there? Yes. So you have a lot of things to say, isn't it? Take a mic and say.
Sir, the first thing first, when there's hypoxia, the tubing color should be looked at.
Yeah.
That is
First look
my
at the
learning.
tubing color when there is an hypoxia.
We have to go system wise. First divide if it's patient factor or machine factor, and once we feel it's machine, go stepwise
Yeah.
in each level.
So first difference is whether the problem related to machine or patient, and then focus on that.
So once the cause is identified, try to troubleshoot from the very basics of that same cause rather than in an unsystematic way. So
Yes, rather than jumping. Once you know that it's a sweep gas failure, then you have to concentrate more on sweep gas. Isn't it?
The problem can be a very minute thing, which can cause a bigger issue. So everything should be taken care of or focused.
Yeah. So, but be more specific. What you are saying is generalized terminology. What do you want to say in this case?
So because we missed the
Yeah,
humidifier.
so don't miss the humidifier or filter in the. So
Circuit.
don't take it granted that it is working. Okay. If you want to change everything.
Change.
Okay, fine.
Sir, in case the situation is going out of hand, we shouldn't panic and still look at things in a systematic way and try to find out, because panicking and going in all directions could only make the matters worse.
Yeah, so you don't get panic and don't get confused with lot of differential diagnosis. Try to be focused.
Sir, all the pressures have to be monitored by we couldn't find the cause, sir. So we saw the pressures also and thought of changing the oxygenator as well. So the distinction, the pressures had.
Yeah, so Malav, you should have definite sign before thinking of change the oxygenator.
We were keeping it ready, sir,
Yeah.
just in case.
Divide the team and find early as the where is the problem, where problem in the machine or problem in the.
That's he said. Somebody said. You have to say something new.
Sir, बाकी choice नहीं रहता.
That's why you're smart enough to start from here.
So many things to say.
Lot of things we discussed, so still there is problem. Yeah, let.
So like in the beginning, we got to know that the problems in the machine with tubings were same color. Then we again went to the patient side, thinking of that. So if we go systematically, it will be better. Like if in the first itself we knew that the problem is in the machine, then finish off the machine thing, then go to the. Or at the same time, the other team will be assessing. If any problem is there, they will tell with the patient.
Okay, so the patient machine related team should have focus on machine. The patient related team should have focus on patient. Then also things would have made a difference. You would have not gone to and fro. Okay.
Sir, we have to identify which component of the machine is being involved. So we have to take care of that
Yes.
particular
So once
segment.
you know the machine, then you have to focus on which component of machine is creating a problem. So then go more specific. Okay, fine.
Handover has to be like thorough, sir, so that we know when the HME filters have been changed, when during the giving care for the patient also, is there any something has happened. The handover is thorough, then we can anticipate things more and we can easily.
Okay, but then it's not that the filter has to be changed regularly. We don't usually do that. Okay.
We should check systematically, sir, from one end of the machine to the patient, where is the problem, so that we can identify it.
Yeah, so once we have diagnosed that the problem is in this part, right from the source till the end, look at every possibility. then probably the things would have been easier to diagnose.
Same thing. So getting familiar with the circuit, we didn't know a HME existed. I mean, we have now
Yeah.
used it.
So you should
first
know
try
the
to
weapons which you are using, isn't it?
Exactly.
Otherwise, you will backfire yourself.
So once we are more familiar with the circuit, it will be easier.
Yeah, so you
Right
should
now
get
it's all
familiar.
seems tangled up.
That's the reason the simulations. You will not forget this. But if I tell you, if I tell you that a filter can get blocked,
We'll never remember.
you will never remember it because that is written as one of the differences diagnosed in the book, but that you didn't. But now you will never forget. So it's better to make mistakes in simulations rather than in real life, isn't it? So this will help you correcting your mistakes. Thank you.
Thank